So take it away.
Well, I'm very glad to be here. I felt left out, so they handed me a cat too. So I'm gonna hang out with Shadow here. He's gonna be my prop for at least part of this. So I have a very little bit about me. I have been in veterinary medicine for the past 21 years as of this month. So I've been practicing for a long time. I've been in shelter medicine in some capacity for all 21 years of that, but worked in general practice and different things. And one of the things that drew me into the profession in general, and something that I have stayed with through the whole time, is definitely cats. I am absolutely a cat lover in every way, shape, and form. All of my furry kids are broken, and I love them for their brokenness and just accept them for who they are. But that is definitively who I am and what I love. I love cats very, very deeply. And within that, part of the things that I started to see, even when I was in private practice 20 years ago, was that there was an issue even then with access to care. And that is something that we are seeing more and more of, and veterinarians are talking more and more about, and are finally kind of coming to the table a little bit and having good conversations with animal welfare groups. And there seems to be a bigger push towards that now to try to make a difference. And with that, like with access to care, one of the things that is really great that we now have is there's some actual research out there about it. The University of Tennessee, which is where I graduated vet school from, they have a program called the Pet Health Equity Program that they started, I think, 6 or 7 years ago. And part of it was because they knew that there was a major issue with access to care. Animals were being taken to shelters, not because the people didn't want them anymore or didn't love them, but because they couldn't afford their care. There was a lot of that happening. There still is a lot of that happening. So this organization, Dean Blackwell came up with it. He started it. They have done a ton of research. Part of their research is they've discovered the number of animals that aren't getting care, and it's because of barriers to access to care. So they estimated about 28% of pets in households don't get veterinary care, and it's because there's barriers to care. Sometimes that's money, so we all know that. Sometimes you just can't afford it. But there's also a major issue with like where vets are located. A lot of times vets aren't located in inner cities where there is a big need for vet care, but there aren't vets who have practices there. So then you run into there's not a location close by, and then people are trying to figure out ways to transport their animals to vets. So location and transportation is a major issue. Then there's cultural and language barriers. So there are a lot of people who really want to do best by their animals, but they either don't have a vet that speaks their language, or they don't know how to get what they need in that situation. So access to care is something that I'm super passionate about. I love it. I love talking about it. I think there is a way for all animal welfare organizations and veterinarians to really make a difference there, where we try to work together and we try to figure out ways to get care to the animals who need it and keep animals in homes. That's a huge part of access to care, especially in areas like LA. One of the big things it can do is its intake diversion. There are a lot of people who take their animals into shelters because they can't afford their medical care anymore. And if we figure out ways to help them with that medical care, if there's more vets doing this, there's humane organizations and animal welfare organizations that can help subsidize some of that in different ways. It really is intake diversion. We are actually keeping animals out of shelters and in homes and supporting the human animal bond. You're really helping build a better community. People feel more empowered to take care of their pets. And then the animal welfare organizations feel better about not having to take a loved pet from someone because they can't afford it. So it's a really important part of veterinary medicine and animal welfare. It's a huge push among a lot of groups right now. Even California is always at the forefront of those things, trying to figure things out. And a few years ago, they did a study of just the animal shelters in California and sent out surveys and got some really good information. And what they discovered that was in California shelters alone, over 340,000 animals weren't able to get the medical care they needed. And that's because there weren't enough vets working in shelters, or that shelter either didn't have a contract with a vet or they couldn't get an appointment. And I think 40% of those animals that weren't getting care also weren't able to get spays and neuters. So even something that now we think of as kind of a basic thing that you can do in so many different ways, so many different places, provide kind of lower cost spay neuter, there's still a huge number of animals in shelters who can't get spays and neuters just because of a lack of access to care. So it impacts the community, but it does impact animal shelters as well. So one of the things that we're really hoping to start doing here and really trying to make a dent in some of that access to care is start providing care to some of the animals in the community as well. So not only like our amazing cats like Shadow here, who is an FIP kid, so he's getting FIP treatment. He may actually be in observation at this point. He's in observation now. So he's completed his 84-day treatment and he's in observation now. I mean, years ago, this wasn't even something that you could do with cats. And now there's legal product in all 50 states that we can use. It's really affordable. There's a lot of ways you can provide this for cats. I have been doing FIP treatments for a really long time and helping people figure out ways to treat their cats. And that's something amazing about Stray Cat is that we definitely provide care for these guys and help where we can. But we're also trying to figure out ways to help the community and really try to keep pets in homes for a lot of these things. So we're starting with doing some access to care, medical care through the clinic. So that's something that we're hoping to really get rolling in the next little bit, finding ways to build that program up so that we can help more and more animals. And part of that is finding ways to kind of expand some of the clinic. We're working on expanding some of the clinic staff. There's a lot of changes we're hoping to make and really make a big improvement in not only the stray cat animals' lives, because I mean, every day we're working with these kitties, but figuring out ways to really help cats in the community as well and really provide them with a way to stay in home. So kind of that one health mentality of keeping everybody together and really supporting that human-animal bond. So that's kind of where we're headed with some of the access to care. Do we want to do a quick tour of the clinic potentially at this point?
Before we do that, Dr. Jennifer, do you have any cats?
Oh, you want to know about my cats? Uh-oh. So I have 12 cats. Literally crazy cat lady. Love it, proud of it. And they definitely range in health and well-being. We have a couple that are what I call our normal kids, but the majority of our cats have major medical issues, ranging from non-mobile CH. We have a kitty who has back legs that she can't use, and so she kind of hops around the house. Some deaf kids, a bunch of CH kids. We have a plethora of broken, adorable, furry children.
Wonderful. Thank you for sharing.
Shadow's gonna go away now. He was a very
good
Shadow.
Thank you.
Oh, I'm attached to him. Sorry. So I can show you a little bit in this area first, and then we can try to do an actual tour of the clinic. So where I'm standing right now, I'm going to lower the table so you guys can see it a little bit better. There we go. So this is kind of the main area when you first walk into the clinic space. Our door is kind of over here to the left, but this is what we call a wet table. So this table has, right now it has kind of a soft padding to let the kitties have something soft to sit on, but under that is a grate. There's a sink attached to it. This is where we're doing our dental. So this is a really nice table that we can use for exams, for doing treatments, blood draws, all those things. But it is also able to do dentals here. So this is where we usually set up for our dentals. So this space is really essential for not only the care of the population here, but also for the care that we're hoping to provide for the access to care and doing some of the dentals for the community as well. So this is a huge part of what we're doing now and what we hope to do. You can kind of see against the back wall, we have this amazing organizational area where we have all of the supplies that we use. So syringes and blood tubes and all of those different things. We try to make it it's a small space, but we try to make it as usable and as functional as possible. So everything's kind of in arm's reach when you're doing things. I'm going to turn you just a little bit so you guys can see some of this stuff as well. Maybe, there we go. Okay. So same area, still the wet table, but we also have our anesthesia monitoring machines. We have our fluid pumps. So some of the things that are essential to being able to do dentals and provide that care, we have all set up here together. And a lot of these things have come here because of donors. So we end up with these items because they're sometimes big ticket medical items. We're able to purchase them because of donors helping us be able to purchase those things. Do you want to talk about yours?
Just an extra, okay. I think.
So let me flip over to Stephanie so she can actually show you some of the things like the concentrator and the anesthesia machines. I'm gonna probably mute myself.
Y'all are all, both of y'all are muted now.
Wait, let me unmute you. You can hear me?
Yes.
Okay, so we'll keep me unmuted then. So off to the side of our wet table, we have anesthesia machines. So this is all how we deliver the anesthesia gas, keep them on oxygen, keep them safe. Down in the very far corner, this little black mechanism down here is one of our oxygen concentrators. Literally, without that oxygen concentrator, we can't perform surgery. That is how we get oxygen to deliver to our patients while they're under anesthesia. So when we're doing dentals out here, that is like literally something that we could not live without, and it's super important with what we're doing. Even when we're not doing dentals, this space is also where we sedate just regular surgeries. So if we have some of these specialty surgeries that like Dr. Stump does for us, this is where the animals are sedated, prepped for surgery, and then they move into surgery. So these items are literally essential for every single day of everything that we do here when it comes to a surgical procedure or sedation or dentals or anything like that.
And Dr. Jennifer, may I add in? I apologize for interrupting. A lot of this equipment is made possible thanks to all of you, and the oxygen concentrator and some of the monitors in particular were recently purchased by one of our donors, James Costa, and his husband, John, and on behalf of their cat, Tommy. So we just want to thank them for making all these things possible as well.
Yeah, that's amazing because it's such an important thing for us to be able to have. So their gift is a huge benefit to the cats here and to the cats in the community as well. So that's just kind of this area with the wet table. And then as we kind of move a little bit through the clinic, the space right next to the wet table is currently used as kind of the doctor's office. Not all of us use the office, but the majority of us do. Our hope, honestly, is to turn this into a space that has a second wet table. So our goal is to basically take this space and add another wet table, another anesthesia machine, another oxygen concentrator, so that we could potentially have 2 procedures going at one time, help more cats that way, be able to make more of an impact for our cats and for the community. So that's something that we're hoping to build into. We're not quite there yet, but that's our hope goal soon, is to have a second set of all of those things so that we can make more of a difference. And then outside of that area, we have our lab space. So we have blood machines, the ability to run some basic in-house laboratory tests, just a variety of different things here. We definitely use an outside lab too, but we do have the ability to run some basic things in-house as well. And then if you curve around here, this is our actual surgery suite. So the same concept. So we still have an anesthesia machine. We have that anesthesia monitoring. We have that concentrator. We have all the same things in here from that perspective, but we also have our sterile space so we can do our surgeries in here. So again, some of these items, the majority of these items, I'm sure are here because of donors, and without them, we wouldn't be able to do the surgeries that we do now. And then we do have a clinic space as well that we keep kind of critical patients. Just depends on what's happening, what's going on. We do have some critical patients here right now, but we have the ability to keep them here and do some pretty aggressive therapy on them if needed, IV care, different things like that. So that's the basic tour of the clinic.
Dr. Jennifer, thank you for that tour. You can unmute yourself and answer this question, but you can't answer if you're a board member. Tell me or raise your hand if you know what this room used to be when this was the South LA shelter before we turned it into a clinic. You can just shout it out.
Locker room.
Somebody said something.
Locker room.
A locker room. I don't know who said it, but I heard that voice. That's right. It was the women's locker room. It was the locker room for the people, for the staff who worked at the shelter, for the women to change in and out of their uniforms every day. And I think, Christy, you looked at it and you said, this looks like a clinic to me. And we're scrappy, and we made it happen. And so what was a space that might have been unusable, we turned into literally a life-saving space. So thank you, Dr. Jennifer, for that really great tour. It's a small space, but it's really effective.
And I think we have a couple of special guests who are going to come, and we'll be able to demonstrate what looks like some of our days. So I always joke with people that a lot of times my day is petting kittens and giving them kisses, but a lot of it is actually doing exams and different things like that. So when these little guys come in, and we've had already in this kitten season, we've had almost 200, right?
Yeah, I think we're probably at 200.
Yeah, we've been pulling even this week too. So our last numbers were around 177, but we pulled a bunch this week. So this is one of probably 200 kittens that we've pulled just this year. These guys come in, they can come in really good shape and be really healthy, but they also can come in with medical issues that we see. We see a variety of things with them, from as basic as flea issues all the way up to really severe upper respiratories. They can come in really, really bad shape. This little guy has actually been in here treated a few times because he had some GI issues. But what we do, so myself and the rest of the medical team, part of our intake exam for these little guys is literally kind of what I call a nose to tail exam. So if they're coming back here to see me, I will literally start at the front end and check them all over. So what I'm doing is, he says, no, you've already examined me recently. I literally check eyes to make sure there's no eye discharge, make sure everything looks okay there. We'll do a little exam in the mouth. Some of these little upper respiratory kids can get ulcers in their mouth. So I'm trying to make sure he has the right number of teeth and there's no ulcers. We're checking little noses to make sure there's no little discharge or anything like that. That all looks good. All the time I'm doing that, I'm also petting, because I'm a cat lady and I really want to pet a kitten. But also I'm feeling and making sure there's no little wounds that we can't see, especially these little fluffy kids. It's kind of harder to see if they have anything weird with their skin. So we kind of have to feel if there's any kind of like scabs or anything. So while I'm petting, I'm literally rubbing every little bit in pieces. So then we kind of pick them up, we look at them all over, make sure everything looks okay. Everything does look okay with him. I'll do a little squeeze of the belly, make sure everything feels okay there and there's no signs of constipation or any discomfort. And hopefully he won't run away while I do this. And then we always make sure that everything sounds good too. When I'm really lucky, they're purring. He's pretty disgusted by my present right now, so he is going to get me.
Is this macaroni salad or potato salad?
Potato. This one's potato, but macaroni is waiting in the wings to be seen as well. This is macaroni. Adorable and fluffy. So same thing with her. Just going to do a really quick, she said, don't. Really quick check of the eyes, making sure there's no nasal discharge. She has food stuck up her nose at the moment, but that's not nasal discharge. Making sure mouth looks okay. Looking in those teeny tiny little baby kitten ears. Same thing, I'm just feeling her all over, making sure there's no little wounds or anything strange that shouldn't be there. We do see ringworm, so I'm also kind of feeling with ringworm for any kind of weird scabs and crusts. Good girl.
Dr. Jennifer, what happens if it's ringworm?
If it's ringworm, we treat them. So we have a special area here at Stray Cat, and honestly, some of our fosters will too. So we have some fosters who will do the treatments at home. So they'll either stay in their foster if the foster feels comfortable doing the treatment, and if not, they'll stay here and we perform the treatments here. They get a really smelly dip that kills the ringworm spores, and then they also get an oral medication, and they get some specialized care for a few weeks while we're waiting on that ringworm to be treated. There are a lot of shelters out there that don't have the resources and the abilities like we do here. And if a kitten or a cat has ringworm, that honestly can be a death sentence for them. So we are able to not only treat ours, but in a lot of cases, pull from other shelters where we know that they're not going to survive. And we're able to take those animals and save them. We have a like 5-week-old kitten right now.
His
cousin that has mange, and it's easily treated, but it is contagious, and that shelter was not going to be able to treat her or handle her care. So as a last minute pull, we were able to get her here and saved a life just from that. Oh, she said, stop it. All right, I'll be done with you. You can go back to your brother.
Amazing.
So that is the basics of the clinic and what we do kind of every day.
Veterinarian like Dr. Jennifer because
she knows how to move them through, get them healthy, and get them into homes.